Alright guys, so I decided to do 3 major injuries in soccer. Here we go. My name is Victoria. Okay, the first one is lateral ankle sprains. The mechanism of the injury is when the foot is inverted position in inverted position combined with a plantar flexion, and it damages the lateral complexion of the ankle. The ankle is one of the most injured joints in the body, not just for soccer, and the lateral ankle sprain can be classified in grades depending on the symptoms as well. And if you see, there are a couple of pictures here showing the different ligaments and different types of ways that you could damage the ankle and why it's such a high classified injury in sports. So the classifications of injury is a grade 1, which is mild. There is a mild stretch in the ATFL, which is usually the only ligament involved in a grade A. Some ligaments fibers may be torn, but there is no little limp, mild swelling, and minimal functional loss in a mild injury sprain. Grade 2 is moderate. There is a complete tear of the ATFL and the partial tear of the CFL. There is an inability to toe raise, and a limp with walking is developed. Range of motion is restricted with swelling and tenderness in level 2 or grade 2. Grade 3 is very severe. There is a complete tear of the ATFL and CFL and a partial tear of the PTFL. And you always go back to the pictures if you don't know what I'm talking about as well. Initially, there is a complete loss of range of motion and inability to weight bear. Okay. So some testings for the lateral ankle sprains are as follows. The diagnostic testing as a radiograph is not usually used to diagnose an ankle sprain, but it is used to rule out a fracture. And we're not talking about a fracture, but just giving you a little heads up there. The Ottawa ankle rules are used as a predictor for patients with an ankle sprain that should have an X-ray. The 3 rules are of the following: the bony tenderness at the base of the 5th metatarsal, inability to bear weight immediately after the injury, and bony tenderness at the tip of the posterior edge of the malleolus. And then the evaluation test, the 2 stress tests that are used to assess injury to the lateral ligaments are the anterior drawer test and the talar tilt test. And if you guys click on any of these videos, you guys are welcome to see how they evaluate those. Okay, my next injury was concussions in sports. As we all know, concussions are very severe and we don't pay too much attention to them, and they're mostly in every sport. I know we like to think that it's just football, but it's not. So the injury to the brain by a direct blow to the head. Concussions are also graded in various methods according to the sign and symptoms, also known as secondary impact syndrome. The mechanism of the injury. It can be caused by a stable object like the floor or a goalpost, or an object in motion such as another person or a ball, such as a header. Sports such as soccer, football, and hockey involve levels of contact and collision and presents risk of injury for concussions. And as you can see right here as well, we have a picture of the blood vessels in the skull and what it can do when concussed. Let's go to the next one. Okay. Detection and treatment. Symptoms for concussion are loss of consciousness, blurry vision, dizziness, confusion, nausea, vomiting, headache, change in motion, all of the following. Some treatments, treated as appeared. Athletes should be removed from the game immediately after the blow. They should receive a thorough assessment from an athletic trainer or the physician. And a person who has experienced a loss of consciousness as a result of the concussion should not return until cleared by a physician. It's very important. Okay, and rehabbing and assessing the concussion. So rehabbing it, you need both physical and cognitive exercises are suggested to rehab a moderate or severe concussion. This appears at the brain for normalizing brain methods, first to cognitive activity and then gradually increase to a physical activity, with each stage separated by a period of 24 hours. The assessment for this would be Sports Concussion Assessment Tool, SCAT, is used to evaluate injured athletes with a concussion. And I'll go ahead and show you an example of what that looks like. The primary role of the coach is to teach, develop, and facilitate an athlete's physical, technical, and tactical and psychological skills related to a given athletic task, while the athletic trainer is responsible for preventing and evaluating injuries and providing first aid care to injured athletes on the field. So that's the difference there. But both coach and athletic trainers should be aware of the SCAT formula. So here we go. So right here is a website you can go to find out more about SCAT and how to do it. I gave you two examples of what it looks like, so the athletic trainer will have this with them to assess the athlete or the person having a concussion, and then right here it gives you a little bit more symptoms and memory functions on that. So my next one is knee injuries. I decided to put both since I'm doing soccer. It's the ACL and the MCL. So for the ACL, usually torn as a result of a quick deceleration, hyperextension, or rotation. Usually does not involve contact with another player, which a lot of people do think that the ACL is torn from that, and it's not. The ACL originates from the medial and anterior aspect of the tibial plateau and runs superiorly, laterally, and posteriorly towards its insertion on the lateral femoral condyle. And I'll show you a picture of that as well. The next one is the MCL. I actually torn my MCL playing soccer, so most commonly sprained from direct blow to the outside of the knee. May also be injured with an excessive outward twist when the foot is planted in the ground. The MCL is situated at the inner aspect of the knee joint and is responsible for joining the inner aspect of the femur, which is the thigh bone, to the inner aspect of the tibia, the shin bone. Symptoms and assessments of both. The symptoms are sudden pain in knee joint at injury, audible crack, unstable, swelling, bleeding with the joint. As if you touch it, it's warm, so it's bleeding within the joint. And then you have restricted range of motion, difficulty straightening the leg, tenderness, pain around the knee. Two ways to assess this injury are, again, the anterior drawer test and the Lachman test. We already saw the anterior drawers test, but I do provide an example of video of a Lachman test you can check out, which is right here. So as you can see a partial tear, a complete tear, and some ligaments described in slide 9 on where is the MCL and where is the ACL. And that is my reference. So I hope you guys liked it, and if you have any questions, please let me know.